All right, we're back with you answering your questions about the coronavirus with Cone Health Chief Physician Executive, Dr. Bruce Swords. Remember, you can text your questions, the number right here down at the bottom, 336-379-5775. Okay, to our text questions. This person asks, if someone tests positive for COVID but isn't showing any symptoms, are they still contagious?
It's a good question. The answer is yes, and we need to assume the answer is yes. And so as long as you're testing positive for the coronavirus, we think that you can transmit that via airborne coughing, sneezing. So yes, you're contagious.
This person is asking, could the virus stick to your clothing when you're out in public?
I think there might be two questions there. One is, can the virus be on inanimate objects like food, your clothes? The answer to that is yes. Whether it can be transmitted from an inanimate object into a person, that answer is much less clear. The mechanism of transmitting that disease would really have to be from your clothing or food or desk into a mucous membrane like your eyes, which is why we recommend don't touch your face, don't touch your eyes. I think that risk is very low.
Okay. Someone is saying, if I'm outdoors, not really near anyone, is it safe for me to not wear a mask? And he gives an example, like when I walk my dog or I'm out on a run.
I think the short answer is yes. If you are outside away from people, there really is no reason to wear a mask. You're not protecting yourself from anything. I think we all recognize that masks are minimally uncomfortable. They're more uncomfortable when you're out exercising. So yes, feel free to take your mask off in those situations. I think from a community effort point of view, if you are running by somebody, passing somebody, it's a nice gesture to put a mask over your face then.
I have seen that myself. So this is something that I don't know if this is going around because I haven't seen this question before. This person is asking, is it true that the virus can only live inside a person for 72 hours?
The data on that is probably not final yet. 72 hours is too short. We're quite sure that people can transmit the virus beyond 72 hours. The duration, how long somebody can transmit the virus, that's not real clear, but it's longer than 72 hours.
Okay. And someone is asking, should I wear a face mask over a face shield? Is one more beneficial than the other? And I think what they mean is, should they wear the face shield over the mask? And is one more beneficial than the other? And can you get away with just wearing one, or do you have to wear both?
Well, first of all, you're right. If you're going to wear both, wear the face mask under the face shield. And they're both thought to be effective. We're quite convinced that face masks are effective. Again, when I wear a face mask, I'm more likely to protect you than I am to have any significant benefit to myself. Some benefit, not a lot. The face shield really is a barrier between you and somebody else, so that if someone does cough or sneeze, any particles will land on the face shield and you won't inhale them. The key to face shields are to make sure you clean them regularly. And part of that question is one better than the other? We don't really know that. Both are better than either one alone. And if you were to come in, when visitors come into our facilities, they will see our staff wearing both, those staff who are providing direct patient care.
And we always get this question, so I'm just going to follow up with it. They want to know how often they should clean their mask.
Another good question, and from a science point of view, we really don't know the answer. My recommendation is to wash them every day. Have a few around your house and wash them every day. That's the safest answer.
Okay. Someone is asking, if you've already had coronavirus, can you get it again?
Great question. The real answer is we don't completely know. Generally speaking, the answer is very unlikely. We don't know of people who have recovered from the coronavirus and suffer again because of a new coronavirus infection. So we think that's unlikely. It has to do with developing immunity when people get the infection the first time. And we just haven't had the coronavirus around long enough to really know the answer.